Happy Friday, everybody. Dr. Amy Ostick here.
Dr. Brian Ostick.
And we are coming to you on our last day of isolation. Last time we talked to you, we were via Zoom. Brian was on isolation. I turned positive the next day. Well, I got tested the day before. The result came back on that Saturday as well. Basically, our whole family, so our kids also. So the good part of that was that we got to isolate together.
Yeah, we're thankful for mild symptoms. The most we had was a slight cough and muscle aches. Luke had a little fever one day, but that was about it. And we've all recovered pretty nicely. So we're lucky in that respect, and we're thankful for that. Thankful to be together during this as well, and being able to be out of that room by myself, which was a little boring. We're back at it.
So our isolate. So what we wanted to talk about today was a couple of things. One is, the second week after diagnosis of COVID-19 is where things can de-escalate really quickly, and you can get into pulmonary vascular complications. So we talked last week about having a pulse oximeter handy, because you can fairly sort of asymptomatically start to desaturate without your knowledge, and so having that, just intermittently checking that, making sure you're okay. That's what we've been doing for everybody this week, is really important. And so we're sort of toward the end of that, and we're feeling very, very thankful. Also very thankful that we did not get my parents or other at-risk people in our close circle sick as well.
Right.
But we wanted to also talk about the timeline of COVID. So from when you are from when you are exposed to when you are sort of done with being infectious or contagious. If you want to read about this, it's on my blog, this month's blog in November, www.healthandhealingdpc.com. Under the blog, I go over basically the definitions of the infectious period, the incubation period, and then there's a diagram of the timeline of what that means. And it's important to understand this a little bit, because you're going to hear different things from different people, and you just want to know what does the CDC say, what does the literature say, what does the research support. You may have, like, your workplace say, we need 2 negative tests for you to come back. Well, that's not evidence-based. That's not really the way we do it and recommend it. And so you want to be able to speak with a level of authority, at least in some scientific knowledge, that what you're doing and practicing is sound. Obviously, speak with your primary care doc, and if that's me, that's what I'm telling my patients too.
Like when I tested positive on October 28th, I had to be on isolation for 10 days because I'm potentially infectious to other people during that period, right? So the LA Department of Public Health called me and did some intake and contact tracing and told me that as of tomorrow, November 7th, that my 10 days is up and I'm free to leave isolation.
Right. So your isolation period, right. It's helpful if you're symptomatic, because your isolation period then basically starts 48 hours prior to your infectious period. When you're infectious, 48 hours prior to when your symptoms start. So if you're symptomatic, and for Brian, that was Tuesday, October 27th. So his infectious period, when he was, the most contagious to people, was 48 hours prior to his symptom onset. So the 25th, 26th were those 2 days that we had to call people, contact trace, etc. And his isolation period starts from the day of symptom onset for 10 days. So Tuesday the 27th is when he had symptoms. That 10 days it was his isolation period, okay? And that's when that's part of his infectious period. After that 10 days, he is not considered infectious. There have been really no significant cases of reinfection, so we're not concerned about him getting it again from our kids who have it still, etc. So he's sort of in the clear after that 10-day mark, which is today is the 10th day. The incubation period. Now, this goes to people who are your close contacts. So for us, as of last week, it was us, and then we turned positive, and then we kind of went into the isolation period. Incubation period are your close contacts. So this virus, like most respiratory viruses, has an incubation period of 2 to 14 days. So from exposure, and we think he was exposed in the ER, it takes about 2 to 14 days. Everybody's different to develop the disease, to get the virus and to develop the disease to the point where you're contagious or having symptoms, etc. This is where the quarantine 2-week mark comes into play. So if you are considered a close contact, you have to quarantine for 2 weeks from the last time you were in contact with that person.
So if you have symptoms and test positive, you're on isolation. That's 10 days. If you're a close contact, you didn't get symptoms, you didn't test positive, you're on quarantine, 14 days.
Right, 14 days. And now the CDC recommends those close contacts getting a test during their quarantine period to see if they, because now what we know now about most people being asymptomatic, to see if they actually turn positive, because then it will change their isolation period. So that timeline, that incubation period is like that time that virus takes to incubate and build enough strength in your body to become an infectious disease. And maybe not. I mean, some people can be exposed. Our middle child has been exposed and hasn't turned positive. And for reasons we're not quite, that we don't really understand. That happens in a lot of different viruses. Some people get it and some people don't, in the same household. So that's where we are with the timeline. Is there anything else I wanted to say about that? I think that's it. And then when you're also part of that, also coming out of isolation, obviously is 10 days, but you have to be fever free for at least 24 hours and symptoms have to have been getting better. So you can technically have a dry cough here and there, but it has to be improved. If you have sinus issues, they have to be getting better. So that's kind of also in the CDC guidelines too, that where you can come out of isolation.
All right. Well, let's wrap it up. www.healthandhealingdpc.com.
Yes.
Phone numbers 818-600-2426.
We'll be back in the office next week. Yes. Thank you to all of our patients, to my patients who have been so understanding during this time. We kind of knew we were bracing ourselves for when this was coming. I was sending out newsletters in the beginning of this pandemic about protocols, when and if we get exposed and God forbid one of us gets infected. Right. Anna Maria, our wonderful nurse, she'll finish her quarantine next week. We're just so grateful for our community out there, for all of the support you've given us.
We've had a lot of people deliver food.
Right.
We've been well fed.
Prayers, positive text messages, encouraging words. This has been a crazy week to be on isolation, I can tell you that much. There's been, the news cycle has been an interesting thing to watch in isolation. We've had to turn on the Christmas music. We started decorating earlier than usual just for our own mental health. And I'll tell you something, that is the biggest part of this that I will send you off with. This mental fortitude during isolation and quarantine is the most important part. If you are lucky and blessed enough to have mild symptoms, but you're going through this isolation, make sure you're doing some things mentally and emotionally to take care of yourself. Going for a walk in your backyard, speaking to people to stay connected, meditation, prayer, whatever it is. But take those times to practice that mindfulness, to give you that mental fortitude to carry you through, because it's a hard couple weeks of isolation.
Agree.
But we did it together. Love you.
Love you too.
Good job.
Bye.